This is the Italian Citizenship Podcast, hosted by Marco Permunian and Rafael Di Furia. Hello there, and welcome to another edition of the Italian Citizenship Podcast, presented by Italiancitizenshipassistance.com. Of course, we are back at it again with Italian attorney Marco Permunian. How are you doing today?
Good, how are you?
I'm doing great, thank you. And today, we wanted to talk about a little bit of a different type of topic, and that has to do with giving birth in Italy, having a child in Italy. I know many people have preconceptions about what it could be like to do it in Italy, but today I wanted to talk about some of the various aspects involved with it, including citizenship and so on. So Marco, let's just start off with the first details about the medical system. How does a person sign up for it, and what do the costs look like for a family that is wanting to have a child in Italy? Monthly costs, doctor's visits, how regular are those visits? I realize I'm compounding a lot of questions on top of each other here, but let's just tackle them all.
Let's first talk about somebody who is an Italian citizen, or maybe somebody who is an Italian resident, so someone who is entitled to receive medical care in Italy basically for free. And the system in Italy works this way. If you have an Italian healthcare card, then you can use the Italian public system. And in most cases, the system works in a way where you receive services for free, especially if you're using the public hospitals, or in some cases, you have maybe to pay a so-called ticket. So the government says, we give you the service. It's not for free, but you have to pay a nominal fee to use the service, and the cost of the ticket is anyway relatively low. We're talking about like 10, 20, 40 euros, depending on, of course, of the kind of services that you are receiving. And so if you go completely through the public system, having the child, or the process that you have to go through, when you're having a child, doctor's appointment, visits, ultrasounds, it comes really at a very low cost if you're using the Italian public hospitals or doctors. Some people, though, even if they are Italian citizens or Italian residents, so they are entitled to receive these services, they decide to go private, and they use private doctors because, they have maybe the freedom to have appointments whenever it's best for them rather than the doctor. It's a little bit easier to deal with them. You go to their private offices, and of course, in those situations, you have to pay them. Now, there are a lot of insurances in Italy offered by employers, or people can sign up for, that make even these doctor's appointments relatively inexpensive compared to other countries where the cost of the healthcare is very high. So all in all, if you are an Italian citizen or an Italian resident, using the healthcare system in Italy when you're preparing to give birth to a child is, generally speaking, less expensive than what you would have to pay in other countries. And of course, if you're using a private doctor for the monthly checks, or the ritual appointments with the doctor, ultrasounds, the cost for a doctor's appointment, for example, it could be in the between 100 and 200 euros per appointment. And again, I'm talking about private doctors here. Some medical exams, though, could be like maybe a little bit more expensive. For instance, there is a medical exam that is becoming very popular, a test that the couple takes, and that basically it's a genetic test where you check if the baby is healthy before you can even see that through ultrasound, and that could have a cost of between, say, 500 and 800 euros, again, if you're using a private facility. So these costs are lower if compared to what happens in other countries. But for example, a lot of workers in Italy, again, I'm talking about Italian citizens or Italian residents, they get as a benefit an insurance provided by their employer, where they can basically be covered for doctor's appointments, whether it's a public doctor or a private doctor. There's maybe a limited number of doctor appointments that can be covered, or to the tests that can be covered, to the amount. Sometimes you get reimbursed only of a percentage of what you spend, but it's becoming very popular in Italy also to be receiving these insurances provided by employers, of course, if you're working in Italy as a benefit. So giving birth to a child in Italy, I'd say in my opinion, it's relatively inexpensive compared to other countries. Of course, the situation is different if you are a foreigner who is going to be in Italy while giving birth to their child. And just to get this out of the way, giving birth to a child in Italy doesn't mean that the child will become an Italian citizen. We've said it many times in our videos. In Italy, the jus soli system is not used, if not in some very exceptional circumstances. For example, if a baby is born in Italy to unknown or stateless parents. Otherwise, if a baby is born in Italy to foreign parents, so in a situation where none of the parents are Italian citizens at the time of the birth, then the baby basically follows the citizenship of the parents. It doesn't become an Italian citizen just because the baby was born in Italy. And, giving birth to a baby in Italy for a foreign citizen who is maybe on vacation or on an extended vacation in Italy, and we have said it many times in our videos, a foreigner, non-EU citizen can be in Italy for as long as 90 days without the need for a visa. Well, if that person has a private insurance that covers that specific event, then, the event will be covered by the insurance. But otherwise, it could be relatively expensive to give birth to a baby in Italy through a public hospital or through somebody who is a private doctor, because even, the public system in Italy works in a way where if you don't have the health national card, so if you're not registered into the system, then you will have to pay their fees in full. And, as any other systems, their fees are quite expensive, especially if you consider that the Italian health system is ranked as one of the top in the world.
That's fascinating. What about also maybe going in a little bit of a different direction here, maternity leave in Italy? Is that something that's guaranteed as a right for residents of Italy? And is it paid maternity leave, unpaid? What are the guarantees that are in place?
Yes, unlike other countries, maternity leave is constitutionally guaranteed in Italy, but it's allowed for a longer period of time, so people can stay basically out from work for a number of months, where you receive the amount, almost all of your salary directly from the state, whereas the employee has to pay only a smaller percentage of it. And then there is also the possibility to extend the maternity leave to another number of months, where you receive a lower percentage of your salary, but that gives you the ability to stay home for a total of 9 months. So a very good period of time. So to recap, basically under the law, you can stay at home in the 2 months prior to the day in which you are planned to give birth to your child, and then the 3 months after you give birth to your child. But that those 5 months can be extended by another 4 months. And so you would be able to stay home from work for a total of 7 months after you give birth to the child. And if you consider the 2 months before the birth, that's a total of 9 months home, where you will receive for the initial 5 months almost your full pay. And then for the additional months, basically when you extend your maternity leave, you will be paid a percentage of your total salary. But still, this is a much different situation, for example, than what happens in the US, what I've seen, unfortunately, mothers just staying home for a few weeks after they gave birth to their children.
Yeah, it's really interesting how the system works in Italy and how it allows for the mother to be home for so long. I mean, this can be quite important in those first initial months. But this is all very interesting. And of course, the big question, how much would actually delivering cost? What is there a cost associated with that?
Like I said before, the public health care in Italy comes at no cost sometimes, or you have to pay a ticket. So like a copay for the service in some other times. And in the particular case of giving birth to a baby, the maximum amount that you have to pay in Italy is about 36 euros, depending on the region, because every region will apply different fees. This also known as tickets. for the services. In the specific case of the baby delivery, the maximum allowed by the law is 36 euros.
Interesting. And then Marco, so I'm curious also about some of the legal aspects. Like, for example, a baby needs a birth certificate. They need that proof that they exist. And maybe in the situation that this baby would be born to foreign parents, like say American parents, how would that even look in this type of case? Will they get an Italian birth certificate, or will they get some sort of paper that says, hey, this baby exists and we acknowledge that they were born in this country? How does that all work?
So for every baby born in Italy, there is, of course, an Italian birth certificate. After the birth, the parents or one of the parents should go to the town hall to register the birth of the child with the papers given by the hospital. And of course, normally that's the father, and the town hall would register the birth of the baby in the registry of the births, and they will automatically create a birth certificate. And when you are given the birth certificate, you can also request a multilingual birth certificate. So if you need to bring it to a foreign country, you can do so more easily without the need to translate it into English, for example, because the multilingual birth certificate comes in normally 5 languages, including English. The birth certificate will, of course, list the full name of the baby, the nationality of the parents, and the full name of the parents, and of course, the date and the place of birth of the baby. Now, specifically talking about Americans, the U.S. consulate in Italy will need to be informed, as they will have to create a foreign certificate of birth, basically called a report of birth abroad, since a birth certificate in the U.S. will not exist for a baby born in Italy. The combination of the report of birth abroad, also since we're talking about Americans, when the baby is born in Italy, the U.S. consulate should also be informed so that they can form a CRBA, consular report of birth abroad. That is necessary because a U.S. birth certificate won't exist. So the combination of the CRBA and the Italian birth certificate will suffice to prove the identity of the child who was born in Italy.
That's really interesting. And what about the citizenship of that baby? Assuming that they're born to Italian parents, that they would probably have Italian citizenship. But if that baby is born to foreign parents, is there a path to citizenship for that child?
So, like I said before, giving birth to a baby in Italy does not mean that the baby will become an Italian citizen. However, there is a facilitated path for that baby to become an Italian citizen. So let's take a step back for a second. That baby will become, at birth, immediately a foreign citizen. If the parents were Americans, that baby will become an American citizen, which is also why the consular report of birth abroad is formed to certify that the child was born as an American citizen. But that child can also become an Italian citizen and will have a facilitated path, because if that child will be able to reside in Italy until the age of 18, then the child will be able to claim Italian citizenship very easily between the age of 18 and 19. And of course, in the event that the child is not going to reside in Italy for years until the child turns 18. So in the case of the parents relocate back to their home country after the birth of the child, or a different country, that child will be able to claim citizenship in Italy through residency after having resided in Italy for only 3 years. So as we all know, normally somebody, a foreign citizen, non-EU citizen, needs to live in Italy for 10 years before they're able to claim citizenship through residency. But a person born in Italy who relocates back to Italy at some point in their life, they will be able to apply for citizenship through residency after only 3 years of residency in Italy.
Monica, thank you again so much for making yourself available for another episode of the Italian Citizenship Podcast. I know many will find this topic very interesting, and hopefully this will help them to be able to make their decisions as to how they want to move forward. And of course, if anybody is interested in getting Italian citizenship, relocating to Italy, or anything else, how can they get in contact with you and your team?
People can contact us through our website, Italiancitizenshipassistance.com, or give us a call. Our number is on the website.
Well, absolutely fantastic. And of course, if you're interested in more information about moving to Italy, Italian citizenship, and other related topics, be sure that you subscribe to this YouTube channel as well as the podcast on your favorite podcast player of choice. But of course, if you're subscribed on YouTube, you are automatically also subscribed to the Italian Real Estate Podcast, where we talk about buying a home in Italy, renting, or where to buy or rent in Italy. Or if you're interested in more information about daily life abroad, about being a dual citizen expat, living on the other side of the world, be sure to come over to my YouTube channel, youtube.com/Rafael Di Furia, or you can search on YouTube, Google, or your favorite podcasting platform of choice for Not Your Average Globetrotter. Of course, we have been here again with Italian attorney Marco Permunian from ItalianCitizenshipassistance.com. I'm Rafael Di Furia. Stay safe and healthy out there, and we will see you all next time. Later.
Thank you.